community organizer and program manager at the New Pride Agenda. Before we begin, I would like to pass the mic off to one of our fabulous interpreters for today's event to go over some housekeeping and instruction. Patrick.
Hola a todos. Buenas.
Buenas.
Vamos a dar unas instrucciones de español en inglés y en inglés-español para establecer la interpretación y luego vamos a comenzar. So at the bottom of your screen, you will see a small globe icon. When that icon is clicked, a short menu will be prompted with options to hear everything in original audio, which means off, in English or in Spanish. Today's panelists will have folks participating in English and Spanish. So if you're not fully bilingual in those two languages, we recommend that you pick the language that you will be engaging in so you can hear the other language fully interpreted. Entonces, al fondo de su pantalla van a ver un globo que dice interpretación. Cuando le dan a ese menú, le va a salir 3 opciones: apagado, español e inglés. Si es completamente bilingüe, pueden dejarlo apagado y escuchar las voces originales de todos los panelistas, pero van a haber panelistas que van a hablar en español y otros en inglés. Entonces, si no va a participar o prefiere escuchar en un idioma sobre el otro, les vamos a pedir que por favor escojan un canal inglés para escuchar todo en inglés, ya sea original o interpretado, o español si desean escuchar todo en español, ya sea en el lenguaje original o cuando los panelistas hablen, o interpretado. The other option of that menu is a mute original audio that can be turned on and off as needed in terms of if you hear the interpretation in the original language at the same level, so you can hear more clear. Y también la tercera opción en ese menú es una opción que dice silenciar audio original, y esto es básicamente para lo que permite es que el audio original no se escucha, así que si está teniendo problemas con la claridad, que escucha 2 voces y está escuchando inglés y español a la vez, lo puede prender o apagar según lo vaya a escuchar. The other thing is that we ask everybody to keep their mics on mute unless they're speaking, y le vamos a pedir a todos que por favor mantengan sus micrófonos silenciados a menos que estén hablando, and wait a couple of seconds between each speaker so we can wrap up the interpretation of the previous person and then interpret you after, once you start. Y la otra cosa es que siempre esperen como unos segunditos después que alguien hable para comenzar a hablar, para terminar la interpretación de lo que dice esa persona y comenzar la próxima. We will also write instructions, these same instructions in the chat for latecomers and for reference of other folks. Y vamos también a poner estas instrucciones en el chat para las personas que van a llegar un poquito más tarde o para que se acuerden si les hace falta otra vez. I think that's it, Ahmed.
Thank you so much. Appreciate that. So just quickly, interpretation along the bottom. If you speak English, if you're bilingual and you speak both languages, you can just leave it off. If you speak English, we ask that you click English so that you can hear the Spanish interpretation, and vice versa. If you speak Spanish, you use that icon to choose Spanish. Thank you again, Patri, for that wonderful explanation. Like I said, my name is Ahmed Mohamed. I'm a program manager at the New Pride Agenda. The New Pride Agenda is a statewide LGBTQ nonprofit focused on civic engagement and advocacy. Our mission is to set and frame the New York policy agenda and focus areas for LGBTQI rights in the state of New York. The New Pride Agenda is joined by Amida in hosting this event. Amida is a nonprofit Medicaid health plan designed to provide specialized coordinated care to New Yorkers affected by HIV. Today's discussion will address the importance of gender-affirming healthcare, sexual health services, including HIV prevention and PrEP, challenges in accessing PrEP, PrEP is pre-exposure prophylaxis, a once daily pill that prevents against HIV contraction, and also the impact of New York State's Gender Expression Non-Discrimination Act, GENDA, and support resources throughout Queens. I would like to take this time to acknowledge that every New Yorker has the right to live their fullest lives, but transgender New Yorkers face barriers to meet basic needs like healthcare. Amida Care provides culturally competent, gender-affirming care that New Yorkers of transgender experience need to thrive. Access to care is still a challenge in mainstream healthcare, however. The solution starts with adequate rates and a commitment to comprehensive gender-affirming care, which will help end the HIV epidemic and create a more equitable healthcare system. So please check out more info about New Pride Agenda and Amida Care. And there's resources that we're plugging into the chat as I speak. Before we meet our panelists for today and dive into the discussion, we'd like to share some special opening remarks by New York City Council member Daniel Dromm.
Hi, I'm New York City Council member Danny Dromm, and I represent Jackson Heights and Elmhurst in the New York City Council. Thank you to the New Pride Agenda for inviting me to give greetings for this really important event with our TGNC community. I'm very grateful to have the opportunity to stress the importance of HIV care and help to our transgender community, which has been disproportionately affected by the disease. It's really important that we get a deeper understanding of PrEP and other drugs that are available to the community, and to understand how HIV/AIDS is transmitted and what it means to have an undetectable count of AIDS or HIV. I just want to thank the New Pride Agenda for all of their work. I want to thank Ahmed, I want to thank Cynthia, and I want to certainly thank Cecilia Gentili for all the work that they've done to bring up this new organization and to make it so important in the lives of everyday New Yorkers, and in this case, those of us who live in the borough of Queens. Thank you, New Pride Agenda. Thank you to the transgender non-conforming community. And I just want to say happy Pride, everyone. Thank you.
Awesome. Thank you for those words. I know I've been talking a lot and I want to hear from our fabulous panel. So I just want to establish some housekeeping, community agreement, establishing some mutual respect. We ask everyone to practice mutual respect. We want this to be a lively and engaged conversation. And this principle is important in doing so. Everything that is shared, we honor its confidentiality to make sure that this is a safe space. And we encourage folks to use I statements when explaining how they feel or what they've experienced. So without further ado, I would like to take an opportunity to introduce each of the panelists, allow them to give their pronouns and a little bit about their work. Alister, do you mind if we start with you?
Not at all. Good afternoon. Thank you so much for having me here today. My name is Alister Rubenstein. My pronouns are they, them. I am the Trans Health Program Manager at Amida Care. And like it was said, we provide comprehensive care to folks placed at high risk for HIV. Historically, it was just HIV positive individuals, and then we opened the plan up to homeless individuals and transgender individuals, regardless of HIV status. So that's how I got involved in our HIV prevention program, which I oversee. And that looks like the primary purpose is education. We want to make sure that everyone knows about PrEP, they know about PEP, they know that it's covered in full. We also want to make sure that people receive support or if they're having trouble taking their PrEP. And what we've seen, thus far is that it has been successful doing these interventions and doing a risk assessment. People are taking PrEP who weren't in the past. So you know, that's great news. And I think that the more that we collaborate and have conversations with other people doing the work, it just enhances it and makes it so much better. So I'm super excited for today's discussion. Thank you.
No, thank you. Thank you so much. Nayra, do you mind introducing yourself, your pronouns, and a little bit about your work as well? I think you may be on mute.
¿Me escuchan? Sí. Buenas tardes, le habla Nayra Berrios. Mi pronombre es ella. Y yo soy especialista en el proyecto de Sex Work 101 aquí en el colectivo Intercultural TRANSgrediendo. Okay. Damos, ¿cómo? Error, ya lo dije. En el programa de Sex Work, de trabajadoras sexuales en Queen, en donde empoderamos y capacitamos y reinventamos nuestros derechos ante un sistema machista, sexista y profóbico. Además, contactamos a nuestra comunidad a servicios médicos y legales.
Awesome. Thank you so much for joining us. We are excited to have you. Dr. Gayge, do you mind introducing yourself, pronouns, and a little bit about your work?
Hi, I'm Gayge. I'm a nurse practitioner and HIV specialist at Callen-Lorde Community Health Center. I see patients at the Brooklyn and Chelsea sites and also via telehealth. So I provide care to a lot of transgender patients. I am trans myself, and it's very important to me to be somewhere where we're providing trans-affirming care and really centering trans patients. Obviously, PrEP is a huge, prescribing PrEP and counseling on PrEP and helping patients figure out what's best for them and fits their lives is a huge part of my practice. And I'm really happy to be at this talk because I think that the trans community often doesn't get the focus that they need on their, who needs PrEP and how to get it.
Thank you so much. And we're happy you're able to join us. And I also see Kiara St. James is with us, another panelist. Kiara, do you mind introducing yourself, pronouns, and a bit about your work as well?
Sure, thank you. Bear with me, everyone. I am in the process of assisting a community member in moving, so I'm actually headed out to White Plains, but I'm gonna try to make myself available on video. So.
Yay.
So you can get to see some of the Bronx background. Jumbo, everyone. My name is Kiara St. James. I'm the founder and executive director of New York Transgender Housekeeping. Bear with me the background. My organization, she, her, that, as in my pronouns. And so one of the reasons I founded New York Transgender Advocacy Group was the understanding that oftentimes when we talk about the needs of our community is through a pathological lens and not understanding that we are whole human beings who have been made broken by these systems. And so one of the things that we do, and I'm very adamant about, is having a holistic approach to how we address systems, especially in regards to the health of TGNC in the New York.
Thank you so much. We're so happy that you can join us, even from the subway. So I appreciate you and your words. And I think it's a good time to just get into the discussion. That was a good segue, that last point about centering transgender non-conforming care. And I guess to level set, I want to define what comprehensive gender-affirming care looks like and why is access so important. And Alister, if I could come to you first, do you mind just responding to that question?
Yeah, absolutely. I'm glad that you are framing it as comprehensive care because there are so many barriers for trans people accessing care. We really have to offer wraparound services and be addressing, the whole person. It's not just, about surgeries. People need mental health services. They may be system involved, having housing issues, nutrition issues. So making sure that either you're offering all those services or you have developed relationships with community partners that you can be referring for these services. I think what I probably should have said first is that it's very important that you understand the needs of the community and you solicit that information from community members. And even better, the staff should represent the community. So when you have trans people leading these health initiatives, they're going to be, the most successful. I mean, I think Amida Care is a great example of it. We have a lot of trust with, the trans community, but we've trained our staff ad nauseum until they got sick of it. I'm trans identified. I work with other trans people, in the community and had a lot of power and was able to help, develop the program. And I believe that that's what, made it successful. And I think that providers just need to be, because of all the barriers, creating very intentional, active, inclusive, and respectful environments for our trans folks. It's not enough just to have a trans competent doctor. Everybody from the waiting room, from the medical assistants, to the signs you have in the waiting room. Are you welcoming people that do sex work? Are your forms are inclusive? All of these things really make a huge difference. If you can provide comprehensive trauma-informed care that really addresses all the needs that going on in a trans person life, I think you're going to be more successful in, having them come back and it being successful.
Mhm. Thank you. Thank you for describing that. You used the phrase wraparound services, and I just want to be more clear about that. Do you mind describing that a bit more? I don't want to assume, but I think that's a good phrase for us to just clarify a bit more.
Yeah, sure. I mean, so essentially that means that if you are, going to the doctor and you're interested in hormones, they're not just going to give you a prescription for hormones and send you home. They're going to look at you holistically as the person and say, do you need a referral for a nutritionist to go to, a food pantry? We have those relationships, do you need a therapist? We have behavioral health caseworkers here that can support you with it. So really seeing the person as a whole person and being that point in contact to connect them to the services and not just being like, hey, you need this and go along your way, really creating those systems to connect those supports to make them streamlined and accessible.
Yes, thank you. Thank you for clarifying that and for your answer in general. Kiara, do you want to add anything to this question? Just talking about comprehensive gender affirming care and why access is so important.
Yeah, so definitely, just to add upon what previous presenter spoke on, just understanding that we work in systems, right? And understanding that our main responsibility and obligation is to dismantle these systems. The world we live in is social construct, right? And we have been indoctrinated into a system that is not affirming of us. And so, when we look at how, especially Black and Brown, TGNC, and B folks have been treated historically, we have always been under, which has always been part of the problem of the Western gaze, when GAZE, when it comes to how they address unique issues and nuances that impact Black and Brown trans women. And understanding, even when I say Black and Brown trans women, you have to break that down. I'm an African American trans woman from Berrios, Texas. So my needs are going to be different than someone who is African American, but they're from Nigeria. And maybe they don't have their documents. So their concerns are more about, like, how am I going to be able to secure my documents? And so oftentimes when we think about healthcare, we have to think about how are we helping and assisting in making sure that the not just the medical needs, but like also the needs in regards to making sure that folks have their documentation. So they have more freedom and access and more agency over their bodies and what their needs are. You know, as an African American, as a Black woman trans experience in the South, my needs, as I said, is going to be different because I was born here. So I'm going to have different concerns with someone who may also be Black and trans, but not an American citizen. Same thing when we talk about trans Latinas. You know, you have trans Latinos who are American citizens or born here. You have others who are undocumented. So how are you addressing those needs? And I think that oftentimes we medical facilities and institutions, they miss the mark. Like, how are you centering the culture, right? How are you centering community to where they feel, I don't want to go into a space, I'm just speaking on me. I don't want to go into a space that it feels clinical and it feels that everything is kind of like, okay, so who was the last partner you slept with? Because, you know, maybe I don't want to talk about that. Maybe I want to talk about the fact that on my way to the train station, I got harassed. So how are you going to help me deal with that? And maybe I come into your clinic and you see that I'm somewhat belligerent, but you're not understanding the reason why that I'm belligerent is because I had to defend myself on the way from my house on the train to your location. So understanding those nuances, you know, I know we all have heard the term trauma-informed care, but at the same time, making sure that we go a step beyond trauma-informed care.
Thank you so much for that eloquent response. I think this is a good point to address this question explicitly, the point of how discrimination against people of trans, non-conforming, non-binary experience and other social determinants relate to health outcomes. Dr. Gayge, can I come to you first in this question?
Yeah, of course. So I think it's important to preface this with, you know, no one is just trans, and that experiencing being a part of other groups that are experiencing oppression, it's not an additive effect, it's a multiplicative effect. But but all trans people are going to face barriers in healthcare based on being trans, in addition to barriers they will face due to other reasons. Even here in New York City, there are transphobic medical providers. It can be sometimes more difficult when sending to a specialist because there's a more limited pool of people, you know, particularly who may accept certain insurances rather than, you know, with primary care. We also know that trans people are more likely to be unemployed, on average have lower income and less wealth, are more at risk for unstable housing, and all of these things affect your health outcomes. It's very hard to, when you're, you know, living in a shelter or on the street, it's very hard to make sure you take your medication every day, because that, you know, survival, immediate survival is a higher priority. And I think that you need, not only does that impact your health, providers who don't understand that can impact your health. And I think, you know, people's outcomes can really vary based on the providers they see or what their access to care is like. People may be afraid to go see a provider. I know that even, you know, here I have patients who, when they, you know, they decide that they really want that hormone prescription and they haven't seen a provider for years because they were afraid about being discriminated against. So, you know, those can all impact it. We're fortunate in New York City that we have a lot of trans-friendly providers, but there are also still a lot of not trans-friendly providers. We're a city with very, very sharp divides between the rich and poor, a very high cost of living, and, you know, very, you know, a lot of racism and a lot of institutional racism that can really impact people in all aspects of their life, including their health.
Thank you for that answer. I want to dig deeper into this point, but focus a bit more on immigration status and how that impacts health outcomes. I think your point about it compounding on top of each other, different identities, adding to more discrimination, not just because you're trans, but because of other identities as well. Nayra, can I come to you and ask you about how one's immigration status impacts access to gender affirming care. In your experience, from the community's experience, anything that you'd like to share?
Ok, amor. Primero que nada, hay una fuerte realidad que vivimos muchas de nosotras como mujeres trans y trabajadoras sexuales, migrantes, latines, y es que el acceso a la salud sigue siendo un privilegio. No todos podemos acceder a un tratamiento o cuidado de salud integral y de calidad que nos permita iniciar de forma segura con nuestra transición como personas trans. Muchas antes, durante y después del COVID-19 seguimos utilizando hormonas del mercado negro. Nuestra salud sigue viéndose afectada, pero nadie quiere ver la realidad que enfrentamos. Sin embargo, también podemos tener necesidades y preocupaciones especiales relacionadas con el cuidado de salud. Si deseamos realizar un hormonal o una cirugía de reafirmación con nuestra identidad, requerimos cuidados de calidad y especialistas calificados y entrenados que respeten y entiendan sobre nuestros cuerpos y cómo nos sentimos. No todas las personas trans tenemos un seguro médico, no todas cualificamos para uno, y si tenemos seguro médico, muchas veces las compañías de seguros nos piden documentos extras y comprobantes médicos porque el seguro debe pagar mi tratamiento de hormonas o cirugías. Para que algunas hermanas es importante complementar con tratamientos hormonales. Hay casos en los que seguros médicos no aceptan nuestras identidades y de forma muy engorrosa y frustrante nos obligan a calificar por qué tenemos femenino en nuestro seguro. La justicia del lenguaje es algo que nos afecta mucho y nos limita, y sobre todo no se discrimina por no hablar inglés.
Thank you. That was a lot of great points, I think, that go missed in the conversations that we have about gender affirming care. So thank you for providing that perspective. I think this is a good point to talk about the Gender Expression Non-Discrimination Act and New York State's commitment to eradicating gender and identity-based expression, and I guess the lack of its implementation in healthcare settings or its full-throated implementation. Kiara, can I come to you? Can I come to you to talk about GENDA a bit? Maybe we could define GENDA and how it protects our trans brothers and sisters across New York State. And then we could piggyback afterwards, other perspectives as well.
Yes, thank you. Yeah, Gender Expression and Discrimination Act has been a law that we have been fighting for the past 17 years. It was finally passed in January 2019. You know, but like, I also think it's important to understand, like last week, my organization and with a lot of our community partners had a Protect Black Trans Women rally in after Adam because in the span of a year, 9 Black trans women have been murdered, right? So it speaks to the fact that even if you have legislation that speaks to address quality of life issues, that on a day-to-day level, oftentimes it's still, you know, we're still living in very violent situations. And so gender is what I love to call the trans civil rights bill, where we all have the right to bask in the sunshine of equality I know it sounds great, but also like that equity lens, the equitable lens is missing from that, right? Oftentimes when we talk about gender, like a lot of folks who, we can tell them, hey, good news is we have gender, you have protections in New York State, not just New York City. But what does that mean if you're unemployed and you live in a high crime area, right? Or you live in an area where you're not really respected for your identities? And so like there's more work that has to get done in those areas of making sure that we are connecting with our faith-based organizations to get them involved anytime that there's community members who are being assaulted or threatened by violence. Along with the non-Black trans women who were murdered in New York City, I don't know if folks are aware, but there was a Black trans woman who was attacked with a screwdriver on the subway train on the same day that we had our rally in Harlem. Another Black trans woman was thrown out of her window by her partner. So it speaks to that, like having these laws are great, but they're not a panacea to what the issues that many in my community are facing. So making sure that along with legislations that improve our quality of life, we also addressing social issues that legislation cannot address.
Thank you. No, I think that was a good summary of the context and what the law aims to do, but where it falls short. So in elements of housing, healthcare, education, and employment, you are no longer, it's illegal to discriminate based on one's gender identity or expression. This is the law in New York State, and we've had advocates fight for this for years. So I just want to name that. Thank you, Kiara and fellow advocates, for bringing that bill over the finish line. But again, as Kiara was mentioning, implementation is such a crucial part to this component. There's like a cultural conversation and component, I think, that needs to follow the legal progress. And so we've heard that even in New York City, the most progressive city in the United States, among the most progressive, there are still transphobic doctors. And so we can see how, although the law in the books makes it seem like everything is okay and peachy keen, that in reality, without implementation, we don't see the kind of impactful change that we want and that we demand for the community. Alister, Dr. Gayge, would you guys like to add anything about GENDA, specifically in the context of healthcare? If not, we can also move on. Yeah.
No, I think that covered it well. I think the biggest thing is just, how do we empower individuals to make sure these things are implemented? So when you go to the doctor's office and that they're not implementing it, it's unfortunate because it places the onus again on like trans people, they're educating their providers all the time on all these different things. And now I just feel like this is a new thing. Trans people, need to educate their providers on, it's amazing. And we did work really hard for it, but we have so much work to do so that we can enjoy, the benefits of this.
Thank you for that. Just sparked an idea it's like literally me thinking in real time, but is there sort of like a directory? I don't know if this resource exists, sort of like a green book for people of trans experience about different clinics or doctors that are affirming and supportive across the city. Does that exist? Or is it just shooting in the dark to figure out like if your doctor is one of the good guys or the bad ones?
There are some resources. There's a resource called Rad Remedy that's like countrywide, that's been put together for trans people, for trans affirming providers. At Amida Care, I take it like very personally. Like I make a list of people that have only been referred by trans people. So I don't know if just like a global one that, works for everyone, but I think part of it is you know, again, hiring trans people in these positions so that we can create guides that we can trust. And we know these are safe providers because trans people have gone and affirmed that. They just didn't say, oh, I went to this training. You know, there's a big difference.
Thank you. Thank you for clarifying that.
If I may, so there are, thank you for the connection, the green book. Many folks may not know or be familiar with that reference. You know, that is a term that is very familiar to a lot of us of the African diaspora who grandparents and great grandparents had to find ways to navigate throughout the South mainly because of discrimination. So there are quite a few Black trans organizations in the city that are working on creating type
I think we might have lost Kiara for a second just because of the connection. Let's see if it clears up. Yeah.
Okay. So can you hear me? Sorry.
Yeah, now we can. We lost you for a second, but I think we can now. Well,
Unmute myself.
yes, now we can hear you.
So my apologies, everyone. So there are quite a few organizations that are doing that work now. You know, we just had a discussion last Friday after the PBT rally in Harlem about next steps. And so along with like creating like a green book for not just for medical facilities, but also businesses, you know, safe spaces for community members if they feel unwell, right? I do feel that, if they feel threatened. You know, I did talk to a lot of folks about making sure that a lot of hospitals and clinics throughout New York City, they should have some type of, like maybe a training spot or something to state that in case TGNC folks feel threatened in the neighborhood, this is a sanctuary for them to come in. You know, I think that's going to be really important. I'm in the process now of working with Senator Brian Benjamin, as well as Senator Kevin Parker, in creating in their specific boroughs a Protect Black Trans Women hotline to address those unique needs that often gets overlooked with like the national hotline and things of that nature. So there is a lot of work happening in regards to creating that green book. And I'll shut up.
Thank you so much. No, that's very helpful in us understanding. And thank you for leading that effort, and of course for organizing that. I think this might be a good point in the discussion. Of course, one component of comprehensive gender-affirming care is HIV prevention and focusing on preventative ways, and then also sexual health generally as a component of comprehensive gender-affirming care. I was hoping we could pivot a bit and talk specifically about PrEP and other preventative mechanisms. And so, Dr. Gayge, if I could come to you, do you mind just defining PrEP and explaining how it works?
Sure. So PrEP stands for pre-exposure prophylaxis. So it is a medication you take before you're exposed to HIV to reduce your risk from HIV. If taken daily as prescribed, the studies showed a 98% risk reduction, which means that you are 98% less likely to get HIV. So if you had a 1 in 100 chance, you now have a 2 in 10,000 chance of contracting HIV. So it's a really big reduction. You know, it does need to be taken. There are 2 medications approved right now, Truvada and Descovy. Truvada now has a generic. They both are equally effective. They're very similar medications. They do have to be taken every day. There is an option for what's called an on-demand dosing for people who are male assigned at birth and not taking hormones. Those you take it's what's called 2-1-1 dosing. You take 2 pills 2 to 24 hours before you have sex, then 1 pill 24 hours after that, and then 1 pill 24 hours after that. So for a total of 4 pills. But that is a limited population who can use that. And then most of my patients who can use that opt to take PrEP daily, because a lot of times it's a lot of record keeping. And if you're having potential HIV exposures frequently, it's, you know, just easier to take it every day. So the way it works is, the way the HIV virus works is when you're exposed to it, it, you know, tries to get into cells in your immune system and write itself into your DNA. So that cell will then make more copies of the virus. Basically, it takes over immune cells and uses them to replicate itself. What the medications in PrEP do is prevent it from getting into your DNA. So you need to build up a high enough level in your cells and in your blood for it to work. So it's not something, PrEP is not what you take afterwards. We can, you know, talk about, there's also post-exposure prophylaxis, but that's different. Big things we need to be sure of before we give you PrEP: that you don't have HIV, because it's not a complete treatment for HIV, it's part of a treatment. You know, we test, you know, and look closely to make sure you don't have HIV. We look at, could you have been exposed very recently? And then, you know, if you had a potential exposure within the last month, we'll have you check again in a month, because the risk of you not being on PrEP, if you're at high risk for HIV, is a higher risk than maybe taking a partial HIV regimen for a few weeks. Other parts of sexual health care is screening for sexually transmitted infections, like gonorrhea, chlamydia, syphilis. And also, I really like specifically talking to my trans patients and kind of opening a door for that conversation, because different people have different levels of comfort about how they want to talk about their sexuality, of letting them know that your sexuality, your ability to enjoy sex, is really important, and that there's not a wrong way to have sex when you're trans. Like, you don't have to feel a certain way about your body or about your genitals, and what you want is important and can impact, you know, the type of how we prescribe your hormones and what we recommend. So, you know, I like to ask, and I obviously always give people the option. They don't have to tell me anything they don't want to. And I can still, you don't have to tell me, you know, if you've had any recent partners or how many, to get sexually transmitted infection testing. I just will offer that to everyone. But I definitely like to ask, like, you know, what type of partners do you have? What type of sex are you having? So we can help assess risk and what you can do. Other preventative measures that people use, condoms, the way they're used out in the real world, have an 80% risk reduction for HIV, which means that if you had a 1 in 100 chance of contracting HIV, you would now be 2 in 1,000. So it's not quite as good as PrEP, but it's still useful. Also, it can prevent other sexually transmitted diseases, which HIV can't, which PrEP can't. So, you know, and people also, you know, they and their partners both get tested. They talk to partners about their HIV status. And, you know, sometimes I'll talk to patients like they're not sure how to have those conversations. I can tell them, oh, here are questions you can ask. Here are things to know. You know, here are kind of conversation prompts with your partner or partners to kind of like reduce your risk and, you know, try to help the patient find ways that can be part of a healthy relationship and not come across as suspicious or anything, because I think it's important to have those conversations.
Yeah, thank you for laying that out so clearly. I kind of want to piggyback off of that, come to both Alister and Kiara before coming to Nayra, and just assessing the trans community's progress in PrEP uptake. I know that there are disproportionate levels of PrEP uptake across demographic groups. And so just naming that explicitly and the forces that contribute to that. And then I guess potential solutions. I know all of this is going hand in hand with solutions, but explicitly as it relates to increasing access to PrEP in the trans community. Alister, can I come to you first and then I'll go to Kiara?
Yeah, sure. I mean, I feel like I just want to be like so much of what Gayge said, because so much of, you know, what Gayge said, because part of it, you know, we talked a lot about the barriers that trans people face just getting to the office, getting through the waiting room, getting, to the doctor. But then if the doctor is not asking us what language do we use, for our body parts, or, that person never had comprehensive sex ed, so they don't understand how to ask these questions and don't understand bodily autonomy. It really is, the responsibility of the providers to be trained and to be able to, solicit this information in a trauma-informed way. And I think it takes tact and, dedication and training. And can we clone you, Gayge? Is that like a thing? Because you're doing awesome work.
So much. Thank you so much, Alister. Kiara, would you like to add to that?
Yes. So yeah, I think it's really also important to understand that, we know that PrEP and PEP are not actually having inroads within the Black community, specifically Black trans or MSMs, as we're still categorized. And one of the reasons for that is because, as I said earlier, if you're not addressing the like racism, right? If you're not addressing anti-Blackness, right? Last year, we saw a lot of national uprisings where Black folks were being attacked constantly. And so, I had a lot of community members, girlfriends of mine who was like, I just want to feel good. I just want to feel good. Like, I'm just tired of the news. I'm tired. And so like that impacts, right? That impacts like the choices we make when we decide to engage in intimate connections with one another. I really hate clinical terms, and because that's one of the reasons why a lot of African Americans are turned off from even coming in for services, because everything is so clinical. So like using language, we have to talk about language justice, how that is being used, how that is being like affirmed in your spaces, right? And so it also faith-based organizations, I cannot stress that enough. We have to make sure that when we talk about, well, why isn't there an inroad happening within the Black community? That you have to understand that a lot of us are still connected to our faith-based communities. We're still connected to, what the pastor said, that my life is an abomination, so I'm gonna die anyway. So how are you addressing that? How are you addressing how we've been indoctrinated to hate ourselves? And so when you say, oh, well, you wanna take this to protect yourself, a lot of us like, well, the pastor already said that I'm gonna die of AIDS, so why should I even bother? So like, how are you addressing that? And so oftentimes we don't, a lot of medical providers, no matter how competent they are, they fail at that, right? How are you creating peer programs for Black and brown trans women specifically, like especially if you're a sex worker, getting them connected to other sex workers who are HIV negative, and say, hey girl, this is how I've maintained my HIV negative status. How are you having those conversations? Are you allowing them, are encouraging them to have very raw conversations, to where they feel free enough to talk about, I had a horrible day. I just needed to let off some steam. And so like, I don't really feel that there's a lot of good intentions, right, that are happening. But at the same time, we're not getting to the heart of the matter, that PrEP and PEP is not working as it is in other communities. And that needs to be addressed. And that's one of the reasons why we need to also make sure we're demanding more health equity type of funds be allocated to Black and brown trans-led organizations who are doing, I'm headed out to White Plains. So I'm assisting someone who's going through a lot because she had to move out of New York City because of gentrification, right? So how are we helping them stay within their networks in the city and not pushing them out into White Plains and Yonkers? It's beautiful out there, I must say, but at the same time, if they're medical, if they feel only comfortable in the city, but yet they don't have the money to get into the city, like how is that going to be addressed? So I really think good intentions are very different than actually actualizing a program that works.
Thank you so much for adding that perspective, that crucial perspective. You talked a little bit about sex work, and I wanted to come to Nayra on this issue, and just if you could speak, Nayra, to how taboo HIV or conversations around PrEP and HIV are in communities of those who engage in sex work. Can you just provide a little bit more perspective about that, please?
Claro. Tenemos que estar claros que para llegar a nuestra comunidad trans trabajadora sexual latinez, migrantes, se debe conocer la realidad que vivimos y lo que enfrentamos las mayorías de los materiales publicitarios promocionados, promoción de PrEP. No hay el reconocimiento a nuestra comunidad de las trabajadoras sexuales. Las putas que hacemos el trabajo en la calle, y somos nosotras las que seguimos enfrentando la realidad. No llega a nuestra comunidad de forma efectiva porque no se nos involucra directamente. Por ejemplo, las trabajadoras sexuales tenemos aún el estigma de hablar sobre VIH y PrEP, porque nunca hemos recibido la información correcta y necesaria. Hablar del estatus de VIH puede ser contradictorio en nuestro empleo, ya que nuestra comunidad, al saber que tenemos un estado positivo, nos excluyen y divulgan nuestros estatus a otras personas, tales como clientes. El buscar el recurso de PrEP también es tema de discusión, ya que si lo tomamos, las personas intuyen que tenemos sexo sin protección. Seguimos siendo este grupo, esta comunidad que está excluida, invisibilizada y olvidada. Necesitamos que las entidades públicas como el Departamento de Salud de New York sumen nuestras voces, nuestras historias y que también se hable que en New York City existe el trabajo sexual y las trabajadoras sexuales. ¿Cómo pretenden educar, sensibilizar si no se incluyen nuestras voces? Hablar más generalmente de la salud trans trabajadora sexual es elegir un tipo de tratamiento de transición es una decisión personal de cada persona trans no binario, ya que las instituciones médicas, incluso programas de seguro médico, deben permitirnos decidir por los tratamientos más adecuados para nosotros mismos. Por ejemplo, las trabajadoras sexuales que no quieren tomar hormonas, pero sí quieren una cirugía de implantes, de seno o resignación de sexo. Debemos tener la libertad de elegir si queremos hormonas o no, ya que el trabajo sexual de la mujer trans usamos todo nuestro cuerpo y las hormonas y bloqueadoras nos disminuyen el apetito sexual. Necesitamos el espacio amigable en que podamos hablar abiertamente y honestamente sobre temas como con doctores, o sea, honestamente sobre temas como estos con doctores. Yeah.
Thank you so much. I think it's important. I just want to underscore your point about amplifying these discussions on every level within the community with providers, and just illuminating some of the stuff that I didn't even know was an issue. And so I appreciate you providing that perspective and being vulnerable in doing so. It's very, very impactful. We are running a bit late, and so I want to get to an activity that reinforces his knowledge. So we'll go over 5 minutes over, maybe 1:05. Before I do that, I just want to generally maybe I will start with you, Nayra. Do you mind just talking about any resources in Jackson Heights, Queens, in general that can be leveraged to increase access to gender-affirming care? Perhaps a little bit about the work that the Colectivo does and the community that you all serve.
Ok, bueno, en el colectivo intercultural Transgrediendo se da recursos comunitarios centrados en la comunidad trans, comunidad LGBTI en general, inmigrantes, trabajadores sexuales y personas viviendo con VIH y otras enfermedades, tales como seguro médico referido para hospitales, viviendas, servicios legales, cambio de nombre, corrección de cambio de género en los documentos, inmigración y beneficios públicos.
Awesome, thank you so much. Alister, Kiara, Dr. Gayge, any other resources that we could leverage? Do you want to speak on this issue before we move on to activity so we can get a little bit of engagement with the audience?
Not specifically. I just wanted to add quickly the comment about having to choose between hormones and surgery. That makes me really sad to hear, and that's a common misconception. While Amida Care makes it very clear, not all surgeries require hormones if they're contraindicated or it's not a part of your gender transition plan. They're not required, and I've helped people with mainstream health insurances get letters from their doctor saying that it's contraindicated for their transition and they don't take hormones. And then in that way, they're able to get surgery. I just wanted to add that real quick.
Thank you, Alister, for providing that important context. Kiara, I see you're unmuted.
Yeah. So I would just say that one of the things I'm very careful about is, like, if someone asks me from the community about access to hormones, surgeries, like I make sure I provide linkage to for them, because we don't really do that at NYTAG. But I also feel that we have to be careful of kind of assuming that as soon as someone comes in who identifies as TNCNB, that the first thing we have to tell them is, oh, have you thought about getting surgery? Oh, these are like, no, we have to be careful, because I know that several community members, my apologies for saying, but several community members, they felt bullied by other community members to get certain surgeries, right? And then when they got these surgeries, they regretted it because it was not what they wanted, it is what their community members wanted for them, right? And so we have to be careful and make sure that as we gain better access for our community, we also let them know, like, look, take your time. You don't have to rush this process. It's like the same thing with virginity, right? When you lose your virginity, right? Like, that's a very intimate moment, right? And so when you're going to do any type of changes to your body, like, I definitely don't want to steer people into that direction unless they specifically ask me to.
Thank you so much for that point. I think everyone has been talking about it a bit, but you just put a fine point on the notion of specialized, individualized care and treating each patient as a full human being and understanding their full humanity and not trying to use predetermined scripts to try to impose some sort of socialized idea or treatment. And so I appreciate this very honest and frank discussion and making room for us to have it. I think we have a poll, a little activity, true or false, that should be going live soon. Yep, there it is. And so because this language, we're offering this in English and Spanish, and the poll is only written in English, I'll just read each of the questions which are true or false, and then we'll give everyone a few seconds to submit, and afterwards reveal some fun answers, and then we'll get final thoughts. But the first question is PrEP, true or false? PrEP makes individuals more promiscuous. The second one is true or false? PrEP can interfere with hormone replacement. The third one is once you start PrEP, you can never stop. True or false? The fourth one is true or false? I can take PrEP only the day I know I'll have sex. The fifth one is true or false? GENDA protects trans TG, NC, NB folks from discrimination only in public city or state hospital systems, but not in private settings. True or false? And then lastly, I should avoid getting an HIV test if I think I'm HIV positive. True or false? Folks want to take a few more seconds to answer these. And then we can reveal the results whenever we're ready. Okay, awesome. So at this point, each of us on the panel will take a question and give the correct answer. So I'll go first. True or false? PrEP makes individuals more promiscuous. This is a big false. Nothing in PrEP makes patients more promiscuous. And so that's a myth, and we're dispelling it in real time. And so if you hear that on the streets, you know that it's false. It doesn't make you more promiscuous. The second question is true or false? PrEP can interfere with hormone replacements. Dr. Gayge, can I come to you for this?
Sure, it is false. PrEP will not impact your hormones. It doesn't lower the level of the hormones. Hormones will slightly lower the levels of PrEP, so it's very important even more important to not miss doses, but PrEP is still very effective in people taking hormones, but it does not impact your hormones at all.
Thank you. Nayra, true or false? Number 3, once you start PrEP, you can never stop. Do you mind giving us the correct answer?
Es falso. Uno siempre.
Thank you.
¿Ya me escuchan?
Yep.
Ok, si es falso, uno siempre puede dejar de usar PrEP, aunque tome los medicamentos regularmente, es necesario para construir protección contra el VIH.
Thank you. So that is false. I just want to underscore that if you do decide to get off medication, you always should have a conversation with your provider or a trusted MD before making that decision. True or false? Number 4, I can take PrEP only on the day I know I'll have sex. Alister, can I come to you for that?
Yeah. So this one is false. There is something called PrEP on demand that if you happen to know in advance when you're going to be having sex, there is a regimen and it's days before. It's not just something you can take right before you have sex. And if you start taking PrEP, depending on the type of body tissue, it can take up to 3 weeks to become fully effective. So it's important that you know when is it going to become effective for you and the type of sex that you're having, and that you're staying compliant until it becomes effective.
Awesome. Thank you so much. Kiara, I'll ask you to give the answer for the 5th one, true or false. GENDA protects TG, NC, NB folks from discrimination in public but not private settings. Is that true or false?
So that is a great question, right? But for most cases, in most cases, GENDA protects you in both public and private. It depends on like if institutions are getting state and federal funding, it's illegal for them to discriminate. Like in housing, if you find that there are housing lists that says that they have availability, and yet when you go in and you apply, they say, oh, well, we don't have availability as of now. We don't really know how to handle your particular population. That is a form of discrimination that you can address. So for the most part, GENDA is very effective in addressing those type of issues of discrimination. You know, like in regards to private insurance, like GENDA doesn't really cover that, but in most cases, GENDA is very effective in making sure that you have all TGNC MD New Yorkers have access to public accommodations, healthcare, housing, etc.
Awesome. Thank you so much. So yes, it's false. GENDA in theory, on paper, should protect in both public and private settings, as Kiara mentioned, but in practice, we still see some cultural lagging. And so that's something that the new Pride Agenda, along with Amida Care, and of course, all the organizations represented on this panel are committed to seeing through. The last question, I'll just take it, true or false. I should avoid getting an HIV test if I think I'm HIV positive. False. It's important, regardless of status, to get tested for HIV and connected to care early to be healthier and unable to transmit HIV to others. And I also just want Dr. Gayge, if you could just quickly, I know for folks who are HIV positive, what does it mean to achieve viral suppression, and why is connecting people to care and treatment so important? I think this is a final point that we missed in the earlier discussion, but relates to this question. And so if you could briefly talk about that.
Yeah, people may have seen that U equals U, and that means undetectable equals untransmissible. One of the goals of HIV treatment is to get to what's called an undetectable viral load. That's when we can no longer find the virus in your blood. You still have HIV, and if you stop medications, it will come, that virus number will come up because it kind of hides out in the body. But what that means is the disease is not going to progress. Your immune system will actually recover a bit. And it also means if we can't find the virus in your blood, you can't transmit it to anyone else. There was a large study done. They looked at couples where one person was HIV positive, one was HIV negative, and those couples consisted of people of various genders for years. And in no case when the HIV positive partner was undetectable did they transmit HIV to their partner. So it's very important for your health to make sure that you don't develop complications from HIV, and that we can get your life expectancy up to that of an HIV negative person by having you in treatment. So it's very important to your health, and also very important to the health of your partners. And in a lot of ways, I know people get afraid to get an HIV test because they may think they're may be HIV positive. They don't know what to tell partners, but there is a lot of stigma still. But in many ways, if someone tells you, I'm HIV positive, I take my medication every day, I had blood work done 2 months ago, is undetectable, and I haven't missed a dose of medication since. In many ways, that's less of a risk of HIV than someone who hasn't taken an HIV test in 2 or 3 years because they're afraid there might be HIV positive, because that person who's undetectable cannot transmit HIV, where someone who hasn't gotten a test in a while may be HIV positive and untreated, and therefore could transmit HIV.
Awesome. Thank you so much for explaining that. I just want to take this opportunity to thank you all for an amazing, honest discussion, illuminating so many different nuances as it relates to transgender health, comprehensive of gender affirming healthcare. I want to take this opportunity. Is there anyone have any final thoughts? I know we've kind of covered a lot, and so it's okay if you don't. A resource slide should be being shared soon. Yep, there she goes. She's on the screen. And we also have a survey that we'd like folks to take 3 or 4 minutes to fill out. It's going to be in the chat, it's placed in the chat right now. Just want to copy the link and fill it out. We'd greatly appreciate it. We're trying to assess how impactful or effective these forums are, and do our best to tailor them and make them more impactful and engaging. But as you can see, there are local resources on this slide. And yeah, I want to take this opportunity. Any final thoughts from anyone on our panel? Now's the time.
So my apologies once again. I really wanted to commit to this. I'm on a noisy bus, but I just want to say thank you so much for this opportunity, Ahmed. I really love this discussion. I definitely would love these to be ongoing conversations with various other community partners. I just want to also let folks know that NYTAG is working in partnership with Senator Brian Benjamin's office on a brochure called Protect Black Trans Women, to talk about what his office is doing to support Black trans women in New York City specifically. We also are going to be having some conversations with faith-based organizations to really get them involved in making sure that when Black trans women are under attack, faith-based organizations have a responsibility to step in and make sure that our community can find sanctuary. Historically, African-American churches have always had a very strong social justice component.
I think you may be muted.
So we want to to Black trans women.
Thank you. I think we caught most of the beginning and sort of the central theme of that, but you might have broken up on the bus.
Talking to me or someone else? My apologies. Yeah, I don't know what part you didn't hear. So definitely we're going to be working also with faith-based organizations. Historically, African-American churches have always had a very strong social justice component. We're going to encourage and continue that, and to extend that to Black trans women.
Awesome. Thank you so much for sharing that. We'll keep an eye out for that collaboration. Any other final thoughts before we say goodbye? It's hot outside, so folks should definitely be intentional about staying cool, drinking water, and there are resources, I think, across the city if folks need help staying cool. So please ask for some help, and make sure people stay chill.
A parasol. This is a parasol, not an umbrella.
Yeah, exactly. Tis the season, as some would say. But thank you all for joining again. Thank you for this lively discussion, and thank you folks for watching. This was recorded, and so please keep an eye out for a recording be sent out. I quickly want to name Alister, Nayra, Dr. Gayge, Kiara. Couldn't have done this without you all, and to the Amida Care Tech team, Sandrine, Shakira, joined by Jackie Johnson today. Thank you all so much for the support. It's a full team effort. And happy Tuesday, everyone. Bye-bye.